How do you feel you could have been better supported at school at the age of 7? Was there an opportunity to share with your school friends your struggles and your needs at the time?
Yes, there was some opportunities for me. However, these were often things that I had to do myself and kind of take that initiative to start this journey of awareness so other people could kind of understand what was happening. But I think that in terms of the school, what the school could have done, I feel that maybe they could have provided a little bit of support, or maybe educating the children that don't know what type 1 diabetes is. I mean, I didn't know it existed before I was diagnosed either. So I think the awareness part is very important for school life.
So someone here is asking, why are school nurses trained on, so basically why the training for school nurses on type 1 diabetes is not mandatory in all schools where there are students with that condition. And I was wondering, Principal, if you could tell us if it was mandatory for you to train your staff, or if it was just because you knew Myrto was a student.
I think you just do it because it's right rather than it's mandatory. I don't think I don't know whether there is a law about it, to be honest. But I think, like with anything, you're always going to have a range of conditions in any school environment. So therefore, you want to make sure there is a suite of training for everybody. I know our nursing team have all come from the hospitals, and they have come into this environment because they particularly enjoy that relationship with our young people, and they like building those relationships. So in terms of training, it's something that they would have wanted to do anyway. We would have wanted to provide it. Whether it's mandatory or not, I suppose in some ways is irrelevant, because you want to do what's right.
Yeah, but what if not everyone has the same willingness? Do you think that it should be mandatory?
But it's already well known, for the school, they know it. Yeah. But, this decision or this discussion about having something that's mandatory, when you have a nurse, they already know what to do. But for me, it could be more than, valuable and obvious, the necessity also for other important players in the school community to be able to have, like, ambassadors and people that would know what to do in cases, should there be a diabetes 1 case of one of our students, or should there be other cases where somebody had to step in case of emergency, especially in those cases where you don't have a nurse. And I've already told you, we have 3,500 nurses, and they usually cover nearby or just adjacent schools. But the reality is that you may be found with a situation where you may not have a nurse present. So the necessity of having this training also for other school life important people would make life, not much easier, but very important in order to have this inclusive environment, as we said, and somebody who would be able to operate in different contexts.
And a question for Mr. Tzoulis, which sounds to me a bit specific, but please comment on research on CRISP, edited stem cell therapy.
Yes.
Maybe tell us a bit about what it is.
Yes, this is extremely specific, I would say. So this is one of the, I would say, new kids on the block in research about diabetes. There has been research in general, I would say, about, we all know that there is lack of insulin, so for decades, for 100 years now, what we do is we give insulin in different devices, injections or pumps. There has been essentially a lot of research during the last 3 to 4 decades about how to stop the autoimmune condition. So far, there have been a lot of failures. Recently, there has been a success in terms that if you diagnose at a very, very, very early stage, you could halt, or I would say you could delay the deterioration. CRISP is something which is about genetics, is very specific, is not here yet, will not be here yet. So the message is, at the moment, we're still in the era when it's all about the most effective way to offer insulin. the era when we will be able to say about curing a disease, essentially about making type 1 diabetes a curable disease, I would say in the best case scenario would be a decade, probably much longer.
And one more, what are maybe, I guess, both of your tips on what to do for first aid when a friend with diabetes faints? Has this ever happened to you, Myrto?
No. I have fainted once, I think. When I was just diagnosed, I was maybe 6 days out of the hospital. But for me, this is a very rare happening. Like, it has not happened often to me.
Mm-hmm.
And there are very few times where my blood sugar has gone so low that I would be near faint. But what I think would be the best thing to do if someone with diabetes faints is to call a nurse or a healthcare professional, because nearly no one knows what to do in that situation, and they don't have the medical expertise to offer help or anything like that. So I think it's important for someone who is trained to deal with this to handle it.
And if there is no one available, what should they do?
The best thing to do is essentially to take the measures to prevent someone with diabetes faint. Let's put it this way, if someone with diabetes starts in any way showing signs or symptoms of feeling very unwell, always what you should think is that this could be a hypo. So that you should find a way to give to this person sugar. If it's high, even if you give a bit more sugar, nothing will happen. So the central idea, and this happens everywhere, even if it happens in the hospital diabetes department, is even if you don't have access to any way to know how low or high the blood sugar is, give some sugar. Usually it takes some time for people don't faint just like this. So as long as someone is consciousness, if you give an orange juice, or you give, let's say, Coca-Cola, or you give sugar with water, something very sugary, not food, within 2 to 3 minutes, the sugar goes up and most people feel better. If someone has really lost consciousness, then you shouldn't give anything to this person to eat or drink because it could aspirate. So you put in recovery position, so essentially lying like this, and then you call 166. And my last comment about this is why it's very important, and I couldn't agree more with the minister that it's not all about nurses. You know, nurses cannot be diabetologists, you know, pulmonologists, cardiologists. You know, they are school nurses and they have so many responsibilities. So let's say every kid with a long-term condition should have a personalized plan by the healthcare professional in charge. This has to be shared with the nurse. So let's say, for example, you should say that, Myrto, if this happens, this is a step 1, step 2, step 3.
Yeah. Yeah, hopefully, sure.
It doesn't have to do with the reply that was just given, because it is something that prevails in the reaction time and the reaction possibility in schools as well. And I'm talking about first aid, that's why I'm not really relating this to that, but I'm really stressing out here the importance of having people on location in schools. And I'm actually relating this to the recent decision we have made in our ministry in order to equip Greek schools with AEDs. And the first reaction was, how can I use it? Οι απενιδωτές. So you can. I'm not relating the one to the other. I'm just saying that in the new era of our learning journeys, I think we should be talking more about what other things we should learn as educators, as school community, when we are in a school where we're saying that we may be using the equipment, we may be buying the equipment, what it's used if we don't know how to use it. That's why this is going to be accompanied by a seminar of first aid for Greek educators, as well as selected teams of students all around Greece. And I'm saying that this is important to be talking about what more we should know in order to provide this safe, secure, enabling, and inclusive environment for every child.
Absolutely, and I know we're running out of time. So one last question for Myrto. What is the one thing that you would ask the government to do about diabetes type 1 in Greece? Honestly, it's not mine. I read it.
So what I would say is maybe try to raise a bit of awareness, because most of the population, I would say, does not know what type 1 diabetes is. And even my parents say that before I was diagnosed, they didn't know what it was either. So this is definitely a very common thing. And I think it's very important, as I said before, to have kind of a basic knowledge of it. They don't have to fully comprehend it, just to have some sort of an idea and to be able to have that kind of awareness.
I think that's fair. Thank you so much. Thank you all. Thank you very much for being here. Thank you, Minister, for joining us. Thank you, Myrto, for organizing. Thank you both for being here.
Thank you, guys.
Thank you. And I think we have the closing remarks now.